fund was to take money from the working people, from us, and put it in to a fund that is going to be used to help us when we need it. And that's what it's developed at. First for the elderly, then for the disabled, and then for children of the disabled, etc. But that was the intent. It was our trust fund. And when they start throwing around words like entitlement, and this is something dirty, why do we accept that?
Right.
Why don't we realize that our grandparents put into that, sometimes our great-grandparents, and took nothing out of it? That's our trust fund. Who is willing to go after the Romney Trust Fund and rip that apart to balance the budget? But yet they're willing to rip ours apart, and we sit back and say, do it! Instead of standing up and saying, this is ours, keep your hands off of it, and stick it somewhere. We are having trouble with that because we listen to all this news media and this horse crap that goes around, and then we feel weighted down. We've got to break that shell and keep pushing forward. When we look at this whole idea of what is Medicare for all, what is HR 676? What is it? We're going to be taking money out of our salary as we work, and we're going to put it in a trust fund again. To be there for what? For us when we need it. And guess what? There's a little piece to that law, HR 676, which is unique. It says the insurance companies will not be able to pay a CEO. It will not go into the market. You're not going to get dividends off of it in the stock market. It's going to be left for one thing. What is that? Healthcare. Is that so weird? But we sit back again and we feel pushed down and we don't stand up for what we need to stand up for. One thing that it is so important that we take and maintain education for all. We must do that. In fact, this morning I got a call from one of our veterans in Region 1A, and he says, oh, I understand. I'm understanding more and more about this new, about health care and Medicare for all. And he says, what should I tell this guy who's an NRA, kind of Republican, really strict conservative, about who's going to pay for it? Who's going to pay for all this health care? And you know, I had to think, and then I told them, you know who's going to pay for it? The person who needs it. Well, what do you mean by that? That person who needs it was paid for it already through his wages. The only thing this thing will do is guarantee that while he paid for it, nobody ripped it off. He says, oh, that'll be good. See, we have to begin to reframe how we look at this. This is ours, it's under attack. We can take the laws and settle all these programs real quick. You know, I hate to say it, but we don't need Medicare. I mean Medicaid once we have Medicare for all. We won't need it because this will be the thing to take care of it. We must recognize that there are a number of things that we need to do, and that is getting out to the Rotary clubs, getting out to the Democratic and the Republican clubs, maybe even getting out to a KKK meeting if that's what it takes. Because, and don't laugh, because we've been invited to some places that I thought, oh, they're not going to invite us, but they did. We must go there. We must tell them that we're connected on this healthcare issue. Anything else can divide us. Guns, how you want to look at people, all that can divide us. But the one thing that unites us is healthcare for everybody, everyone in, nobody out. And once we get that, that in our mind, no matter how you connect with other people, no matter what you have to say to make that clear, it will happen. Thank you, and we'll take any questions at the time.
Thank you, Bob. Thank you for sharing lessons about how to frame things. I bet you were a good chief steward.
Yes, I was.
I wish you were my steward. Okay, our last panelist is Michael Lighty from the California Nurses Association, National Nurses United. And I think I've known you since 1994. Long time working on this stuff. He's one of the central figures in California in the single payer movement, and nationally, I should say, in the single payer movement. So, Michael,
thanks.
The podium.
Thank you, Don. I'll be brief since I spoke earlier, but I did first meet Don when you were a Labor Council representative and a steward in the machinists, right? That's right. So he was a
steward in the UAW in Detroit too.
Yeah, well, you were a kick-ass steward, and you know when you're up on stage with a couple of stewards who are saying horse crap instead of what they really mean, you must be in a family-friendly environment. All right. So quickly on Medicare, it really just to emphasize what I was saying earlier, it really is a question of, are we going to tax the rich or are we going to kill people? Because people already, we know 84,000 people die already for lack of insurance. We know that if we continue to cut Medicaid, as Peg said, people will die. We know that if you restrict access to seniors who are in more perilous health conditions often, they will die. And we also know that $321 billion each year is given in tax subsidies just so the top bracket can itemize their deductions. Right, so that's $321 billion that would go a long way to the states being able to maintain Medicaid. Go a long way. So it really is that. And so that is the choice we have to put before people. I think it's also important, we were doing a campaign within the AFL-CIO urging unions and the AFL-CIO not to endorse candidates who support cuts to Medicare and Social Security. And that is crucial. And when they say entitlement reform, by the way, that's what they mean. Yep. So when President Obama said he's open to entitlement reform, that's what he meant. We will cut Social Security and Medicare and Medicaid instead of taxing the rich. And that's morally wrong. It is wrong. And so we will, look at, when it comes to October and November, we're going to be in a tough spot, probably. Because there's going to be something, in fact, he gets his hedge fund, he and his hedge fund buddies, they get $21.4 billion in tax subsidies because of the carried interest, right? Where remember, the hedge fund people like Romney don't actually have tax at the higher rate. They're taxed at 15% because it's not really wages, it's just earnings.
They don't work.
Right, they don't work. They just sit back and collect. It's money on money, where's labor?
Right.
So it's fine, but we also have to keep up the street heat, and that's what we've been doing, right? And all of us have been doing for the last year and a half or so, is keeping up the street heat to preserve Medicare, and that is essential. I also think we need to include it in our outreach to OWS as we work with Occupy movements. It's the same fight. It's Wall Street imposed austerity, or it's a society in which we all participate and thrive. And the fight over Medicare is really the front lines of that struggle. We have a campaign called the Main Street Contract for the American People. One of those elements is tell me where it hurts, right? And so we very much want to hear stories like the Medicaid Project. So you can go to the nationalnursesunited.org website. We're collecting those stories, and we believe those stories are crucial, as ADAPT is doing and others, to promote our perspective on these issues. And finally, I would say, taking a page out of New York, if you can do it in Texas, you can do it anywhere. Thank you.
Let's see. Thank you, Michael. And I like the street heat. The nurses are very good at street heat. That's it's critical. It's a good inspiration for the rest of us to engage in street heat.